Street, Mumbai-based omni-channel pharmacy Zeno Health has acquired TABLT Pharmacy in a bid to expand its network in semi-urban and rural parts of Bengal, Odisha, Bihar and Jharkhand. This comes just a month after Zeno Health bagged $25 million in a Series C round. Joining me now to discuss the fundraise is Girish Agarwal, the co-founder of Zeno Health. Girish, thank you so much for joining us on Startup Street today. You know, the last time I spoke to you, you had raised the $25 million. You've now acquired TABLT Pharmacy. So how much did you buy TABLT for? Take us through the contours of the deal and what was the rationale?
Sure. Thanks, Arundhati. So we bought, I can't share the exact value of the deal, Arundhati. But what I can share is that it was an all-stock deal. And the way we valued the deal was multiple of the revenue, which stood at around 50 crores ARR at the time we bought TABLT. And we acquired the business along with the entire team. And we are very fortunate to have the co-founders join our team, which powers our vision way more than how we were doing till now.
All right.
And why did we acquire TABLT? So 3 reasons, Arundhati. One, it allowed us a very, very efficient distribution model to enter Bharat. Second, we got an amazing team on board along with this acquisition. And the third being that it allows us to power our vision of democratizing healthcare in the eastern part of the country, which was far away from where we are present today.
All right. So it's also going to help you with your expansion plan. So talk to us about TABLT. It caters to tier 2 to tier 6 cities in eastern India. So what's the firm's current reach and what kind of revenues are they clocking?
So currently the firm is clocking around 50 crores of revenue run rate.
Right.
And the reach is concentrated in West Bengal, and we have started to expand in Odisha, Bihar, and Jharkhand as well with the community partner model. So there are approximately 300 community partners serving over 700 pin codes across these 4 states, out of which 80% of the business is still in West Bengal.
Right, so 80% of the business is still in West Bengal. So you're already expanding. This acquisition helps boost your plans to expand across eastern India. So talk to us about the number of customers that you're currently catering to and how many more do you hope to reach this fiscal, especially via this acquisition?
Sure. So currently we are serving around 300,000 users every month, Arundhati. And with this acquisition, this number is planned to from 300,000, we plan to get to 500,000 users a month by the end of this financial year, out of which approximately 50% of the addition is going to come from this acquisition.
All right. And do you have any more acquisitions in the pipeline? Are you in talks with anyone? What's the inorganic growth plan for Zeno Health?
Yes, Arundhati, we feel that this is a very critical lever for us towards our vision of democratizing healthcare and impacting 10 million lives a month, which we are chasing. So we are in talks with a couple of companies as we speak, but they are very early talks. But yes, over the next 2 to 3 years, we'll be using inorganic acquisitions as a very key lever for our growth.
So over the next 2 to 3 years, you are going to use inorganic growth as a key lever for growth. But can you tell us what these companies are? It might be early stage, but where are you looking? What are the companies that you're looking at? Can you give us some idea?
I can't divulge the names because it's too early. But how we are looking at it is we are looking at companies which allow us to enter a new category of medicine altogether. That is a company that we are talking to. And we are looking at another company which allows us to take our brand Good Aid. We have our own label of generics under the brand name of Good Aid, to take that to a larger part of the country outside of just the captive Zeno ecosystem. So there is another company which we are talking to from the perspective of distributing Good Aid pan-India. So yeah, those are the nature of talks we are in.
All right. But what are the kind of revenues that you're currently clocking and how much do you hope this acquisition will add to your revenues?
So currently we are doing approximately 300 crores annual run rate, Arundhati, with this acquisition, by the end of this financial year, we plan to grow the revenue by around 75%. And wherein, again, approximately 50% of that delta is going to come from this acquisition.
All right. And, you did mention just now that you're looking at more acquisitions and it's going to be a big part of your growth story. So would you be looking at raising more money in the near future? Has the last fundraise been fully deployed at this point?
No, we have just raised that capital, Arundhati, and we'll deploy it over the next couple of years. I think that's a runway that serves another 2 to 3 years for us. However, we'll keep raising capital as the vision is way too large for the capital that we have raised till now and the last round. So we'll keep raising capital, yes.
So you will keep raising capital. All right, Girish, thank you so much for joining us on Startup Street. And we wish you all the best with all of these plans going forward.
Thank you.